family of a pregnant woman, Miss Sakil Stewart, is claiming that hospital negligence has caused her to pass away. A family from Hanover is alleging that negligence on the part of the hospital in Hanover has resulted in the loss of life of a 25-year-old pregnant woman at Noel Holmes Hospital. Almina Martin, who is the woman's mother-in-law, is insisting that an investigation is required into how Miss Sakil Stewart passed away on Monday, September 28th. Several persons from the Johnstown and Esher area of Lucy in Hanover gathered outside of the hospital awaiting answers as to what could have possibly caused the passing of Miss Stewart. The 25-year-old was admitted to the hospital for high blood pressure, but later it was reported that she had lost so much blood that she passed away. Time of her passing on September 28, 2020, Miss Sakil Stewart was all of 8 months pregnant, with an expected delivery date of October 12, 2020. According to her spouse, Romario Murray, Sakil went to the Lucy Health Center to get her usual maternity checkup. While doing her health checks, it was revealed that her blood pressure was extremely high and that she had to be admitted to the hospital. According to Mr. Murray, she was later placed on the ward for observations and treatment. She was also asked to be transferred to the Savannah Lamar or Cornwall Regional Hospital, as she was in a lot of pain. Mr. Murray also said that she was neglected by staff at the hospital while she was in great pain. According to Mr. Murray, he left her talking happily and went on to Falmouth, where he later received the news that he should come back to the hospital. It was at that time when he returned to the hospital that they made him aware that Miss Sakil Stewart had passed away. According to family members, Miss Stewart had signed a document for medication to be administered to her, and it is believed that this medication may have caused complications which may have led to her passing. Miss Almina Martin, who is Mr. Murray's mother, who was anticipating welcoming her first grandchild, is at a loss for words. She is currently grieving. According to Miss Martin, they are extremely careless at the hospital, and we need a thorough investigation into the passing of my stepdaughter. Staff members at the hospital held a meeting over the matter and have stated that everyone had to await the results that would come out of the autopsy. Pregnancy is always a very delicate situation, and hypertension and pregnancy sometimes goes hand in hand. High blood pressure or hypertension is one of the most common medical problems that are encountered during pregnancies. Hypertension leads to complications in at least 10% of pregnancies globally. High blood pressure related disorders during pregnancy are classified into 4 categories. Categories include gestational hypertension, which is transient hypertension of pregnancy, or chronic hypertension, which is identified in the latter half of the pregnancy. This is preferred among older women who are pregnant, and this term is widely used and referred to as pregnancy-induced hypertension because this is a more correct term. There is also chronic hypertension, preeclampsia, eclampsia, and preeclampsia superimposed on chronic hypertension. Let us discuss blood pressure in general, or hypertension. Hypertension or blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps blood around your body. High blood pressure, however, or hypertension, is when this force against your artery walls is too high. There are different types of high blood pressure in pregnancy. First, let us look at gestational high blood pressure. This is high blood pressure that you may develop while you are pregnant. It starts after you are approximately 20 weeks old pregnant. You usually do not have any symptoms. In many cases, it does not cause any harm to the pregnant mother or the baby. Gestational hypertension normally goes away within 12 weeks after childbirth. It does not raise your risk of high blood pressure in the future. However, sometimes it can be extremely severe, and this may lead to low birth weight or preterm birth. Most women who experience gestational hypertension sometimes go on to develop preeclampsia. Chronic hypertension is high blood pressure that starts before the 20th week of pregnancy or before a woman becomes pregnant. Some women may have had high blood pressure a long time ago, before becoming pregnant, but were not aware of it until they got their blood pressure checked during their prenatal visits. Sometimes, however, chronic hypertension can also lead to preeclampsia in pregnancy. A third category is preeclampsia, which is a sudden increase in blood pressure after the 20th week of pregnancy. It normally happens in the last trimester of pregnancy. In rare cases, symptoms may not start until after delivery has happened. This is also called postpartum preeclampsia. Preeclampsia also includes signs of damage to some of your organs, such as your liver or kidney. Signs of preeclampsia include protein in the urine and very high blood pressure. Preeclampsia can be extremely serious and may cause of life. Sometimes the mother loses her life and the baby may also pass away. The cause of preeclampsia is currently unknown. Let's look at the risks of preeclampsia. A woman is at risk of getting preeclampsia if she has had chronic high blood pressure or chronic kidney disease prior to getting pregnant. She may have also had high blood pressure or preeclampsia in a previous pregnancy. She may also be suffering from obesity, or she may be over the age of 40. Other risks include pregnant women who are carrying multiple children. Also, if you are of African American ethnicity, you are at risk of preeclampsia. Another risk that presents itself is a family history of preeclampsia, as well as having certain health conditions such as diabetes, lupus, thrombophilia, which is a disorder that raises your risk of having blood clots. The risk is the use of in vitro fertilization, egg donation, or donor insemination prior to becoming pregnant. Problems associated with preeclampsia in pregnancy include placental abruption, poor fetal growth, preterm birth, stillbirth, damage to kidneys, liver, brain, and other organs, and the blood system, as well as a higher risk of heart disease for the pregnant mother. Symptoms include high blood pressure, too much protein in the urine, swelling of face and hands, headaches, vision problems, and pain in your upper right abdomen, as well as trouble breathing. Like, comment, share, and subscribe. Let me know what you think about this issue of preeclampsia and chronic hypertension during pregnancy. Remember, take the necessary precautions if you're currently pregnant. Do your health checks. It is also advised that prior to becoming pregnant, you should do the necessary health checks to ensure that your body is healthy enough to carry a child. You need support as a pregnant woman, and of course, your healthcare center and your doctor is your best bet. But your family needs to be there to support you as well. So remember to take care of yourself. And during this difficult time where we're undergoing a pandemic that is incessantly plaguing the globe, always remember that you should take all the necessary precautions to remain safe and negative for the pandemic. If you need to wear your mask, please do so. And of course, remember